Good morning, everybody. Dr. Gabriele Jasper MD, interventional pain, uh, specializing in interventional pain. I'm here with Jeremy Vickers
Yeah,
as my co-host. We're going to talk about pain and how you can become painless
right.
with Dr. Jasper,
That's
Dr.
right.
Gabriele Jasper.
MD.
Well, we're live here today on hopefully, well, the people that see me live, I don't even have to tell you, it's on Facebook or
YouTube.
YouTube,
Mm.
and you can get it on YouTube. But anyway, I just want to tell you what I do. I like to always mention what I do, which
Yeah.
is interventional pain, which is different from just plain pain management,
Yeah.
and it's different from orthopedic surgery, different from neural spine surgery. It's a subspecialty, a super specialty where we treat pain, and this is my opinion. We treat the pain generator. We try to find the pain generator. Once we find it, we stop it from hurting you specifically,
Yeah.
and the pain goes away. Miraculously, the pain goes away. Now, people need to understand that there's multiple pain generators most of the time. And if you have a bad back, you got a bad back, and chances are you're going to have a bad back for life, unless you're a person that did something and got a small herniated disc, caused a tremendous amount of pain. I go in there endoscopically, or sometimes just a measly injection, an epidural injection, get rid of all the pain for life.
Right.
You know? Of course, when you get older, I got patients that are in their 80s, 90s. They always have some form of pain,
Yeah.
and that's what the beauty of interventional pain is. We find their pain generators and we get rid of it one at a time, and that's my way of doing it. Not everybody does it. I do it one at a time, because when you do it one at a time, at least when you get rid of that pain and it comes back again, you know how to do it. Sometimes people give you the shotgun approach, get rid of all the pain, and then you get to the point where you give too many injections, and you don't really know where the pain generator is, because there's a lot of pain generators, which has always been a topic of this show, that cause the same pain. So you could have 5 pain generators causing the same pain. So you need to find out and isolate with diagnostic blocks, being able to read the MRI, and coming up with a plan to get rid of the pain one at a time. And that's the only way I think that it works, and it works in my practice, and that's why I have a busy practice, and patients come back when need be, and they send their family members and friends and coworkers. So what do I do normally? A little bit of a brief synopsis of what I do. I haven't been on in a long time. People listen to me on the radio. A lot of those are repeats. They're fun radio. I tell some good stories. Maybe if something pops up today, we'll tell a good, funny story.
Yeah. Paul back in the radio studio, he's always updating our best of reel, and he plays those on the days that you're away. So it's all your best stories, all of that. It's really fun.
So today might be a good story coming up. Who
Yeah.
knows? Whatever pops into my mind. I've had a long, happy, and fascinating, fun life so far.
Right.
Thank God. Knock on wood.
Knock
Everything's
on
good.
wood, buddy.
And there's a lot of good stuff in the future. We have plans on living a long time and having fun. Of course, I got my own pain, and I treat most of my pain one at a time.
Right.
Myself.
Yeah.
Like I got a bad shoulder, and I give myself injections. I give myself injections anywhere from steroid injections, but I've cut back on that. If somebody has joint pain that eventually might need a new shoulder, a new knee, a new hip, there's this stuff called regenerative medicine where it does not break down protein. It's not a cortisone. It's not a steroid, and it doesn't hurt you. And in fact, they've shown statistically on studies that it actually regenerates a certain percentage of your joints and your cartilage. Theoretically, that's what it does. But what it doesn't do is break it down.
Right.
Because it builds it up. Because what it does is you put it into the body, what could be stem cells, it could be PRP, platelet-rich plasma, and even the platelet-rich plasma systems are getting better. They have more growth factors in it, and they're isolating different things that are good in the plasma, platelet-rich plasma that you can use.
That's great.
And we got amniotic tissue, as exosomes. It's a field that is growing and growing. The only downside, insurance doesn't pay for it.
Right.
So it's very hard in Ocean County to get anybody to pay for anything. So guess what? I don't do a whole lot of them. Nobody wants to pay for it, but I do it to myself. Why? Because I don't mind paying for it because I think it's better than the steroids.
Right.
You know, in the beginning, you might, if it hurts a little bit and you got arthritis, tendonitis, maybe a steroid in the beginning, but you don't want to push it. You can't do steroids every 2 months, every 3 months, maybe once a year.
Right.
But any more than that, it becomes not good for you, because it's a systemic hormone. It goes throughout the whole body. And when it goes throughout the whole body, it affects every cell in your body. Why? Because it's a steroid. And steroids go into the cell. It goes into the nucleus. It's not like a protein derivative where something that's going to go on the outside of the cell and cause something. It actually goes inside and changes the inside components to do certain things, like decrease the inflammation of these cells, right? So not just the inflammatory cells, but all the cells in your body. So overall, don't get too many. Don't allow somebody to give you too many steroid injections. For example, we call it dexamethasone. We call it. There's another one called triamcinolone, which is Kenalog. That's the most common one for joints. But be careful when it comes to that. I want to tell a little story since we're talking about joints. My friend Don Mion, who's actually coming down tonight, we're going to go do some crabbing and clamming. We already got a couple.
Don.
Yeah, Don. We already got a couple. Felix is down. Tiziana's down.
Great.
Frank Sanchez is down. Rosalind's there. We're having a good weekend. We're going on. I got a 19-foot Boston Whaler. We'll go out to some secret clamming beds. I call it secret clamming beds. However, the seeding of clamming in Barnegat Bay has been tremendous. I donate as much money as I can. I would hope that everybody else starts to donate to the Fish and Wildlife Division of clamming. And they seed these areas, and it's almost anywhere you go now in the Barnegat Bay, you're going to find clams. So if anybody likes clams, you just go out and find a place where it's about, knee deep or maybe a little deeper. You go out and just move around with your feet and you find clams. But anyway, he called me up about a month and a half ago and said his wife is having tremendous pain in her knee. It's hard for her to work, and can I give her a knee injection? I said, yeah, get an x-ray. Come down. I'll look at the x-ray, and I'll see what it is.
Right.
But I didn't hear from her. I said, when's he going to come down? I'm trying to talk her in. She don't want to drive all the way down here. So what happened was he called me, I think 2 days ago, and said that she can't even walk, and she had injections by a local guy. I said, well, what do you mean a local guy? You asked me to do the injection. Why didn't you bring her down? She didn't want to drive so far. All right. So I said, well, did the guy give her injections in the knee blindly? In other words, just stick the needle in? Or did he do it under ultrasound? Or did he do it under x-ray? He goes, let me find out. He says, no, just did it blindly. I said, there's a chance. It's two things. Either the knee is too far gone, or you didn't even get the medicine where it's supposed to be. And she even said that it got worse after he gave the injection, which to me is an indication of it didn't go in the right spot. Because if you put these bolus of medication in soft tissue, like you could stick it into a tendon, a ligament directly, and that's going to hurt. And it's not going to help the arthritis or meniscal tears or stuff like that. And sure enough, she comes out and she told me that he just, stuck the needle in without anything. So we brought her to the room. I put the x-ray machine on her, and I find exactly where it had to go. I put the needle in to the joint, and I put a little dye in it because I did it on the x-ray. I put the dye in it, it's a blob, which means it's not in the right spot. It's not spreading throughout the joint. And then I put in another 2 millimeters, and it's still a blob. Now I'm in a place where a person who does it blind and does it on hundreds of people, that's where they're going to do it. Because that's what I do. I put it in. I know I'm going in the right direction, but I still got to check it with the dye for the depth. I moved in another 2 millimeters. Poof, it goes right in beautifully. So that would have been 2 times somebody might have missed by doing it blindly.
Blind stabs, yeah.
And you're talking like 4 millimeters difference, which is less than a half a centimeter in the knee, right? And it finally got into the right spot. And I put some local anesthetic, and I put the Kenalog, the triamcinolone, And she gets off the table. By the time she was standing up, she goes, "Oh my God, the pain is gone."
Huh.
I said, "Let me ask you a question. When you finished right after, 5 minutes or less after the injection, were you 100% pain free?" She goes, "No." I said, "Then he put it in the wrong spot. So now, hopefully, it's gonna last long because there's a good chance."
Yeah.
She didn't have real bad arthritis, just a little bit, but she had a torn meniscus. Now that meniscus, if it's not real bumpy or loose, the injection is going to work for a long time. Um, and if it comes back right away, that's a perfect patient because she really doesn't have that bad arthritis. She's got really, the meniscus, which is like collagen. It's protein, right?
Mm.
And it's broken down a little bit. She would be an ideal candidate for regenerative medicine, maybe PRP, uh, amniotic tissue, or stem cells, or something like that. And she would do better. It would maybe not regenerate it, but theoretically it could,
Right.
and it could last a long time without surgery. And if that doesn't work, then there's probably a loose piece in there that's flapping while she's walking, and they go in endoscopically, like arthroscopy of the knee,
Mhm.
and they clean it up, shave it down, and then they do good. So that's the first thing I want to talk about this morning.
You gave me a knee shot probably 2 years ago. I haven't had a problem since.
Yeah.
Yeah. I mean, because I was starting to feel pain. It's my weak knee. There's like I'm probably eventually going to need another, but right now there's
Well,
no.
what was the pathology? We did an X-ray. What did it show?
I can't remember. It was like 2 years ago, and but my point in bringing it up was it felt great afterwards. I was amazed. I was even surprised that it didn't really hurt. You think getting a needle in your knee, you're like, oh no, but no.
Well, it's all because I put it in the right
Yeah.
spot. What I do is I make sure through the X-ray or ultrasound that I put it in the right spot. Assuming my nose is running a little bit, but but the bad part of doing it blindly is the fact, of course, we talked about it's not going in the right place. But the worst part about it, if you got the same person putting it in the wrong spot, what do you do when a knee injection doesn't work? Especially if it worked before and it doesn't work anymore. You got to get a new knee,
Mm.
or maybe when it comes to a meniscus or foreign body in there, they do it arthroscopically. But they don't do much arthroscopic surgery anymore. The knees get bad, and they notice that it gets to a certain point, arthroscopy is not going to work.
Right.
So they just give you a new knee. Now, imagine, and this happens all the time, where a doctor gives the needle in the wrong space, not in the wrong place, and it never gets better. They get knee surgery and they get total knee replacement where they might not have needed it. Because there's a lot of people like you, for 2 years, you've been doing okay.
Yeah.
Because it was put in the right spot. So be careful before you go get a knee replacement and you've had injections that were done blind. They got to be done on the ultrasound or X-ray. Now, ultrasound, it's very accurate when you have some fluid in the knee and they drain the fluid.
Right.
If you don't have fluid in the knee, somebody can pretend to be very accurate under ultrasound with no fluid in the knee. It's not that accurate.
Right.
It's somewhere between blind and X-ray. X-ray, you are accurate. You put dye in it, and you know exactly where it is. When you have fluid in the knee, you pop under ultrasound. You can see the fluid. You pop the needle into it, and you drain the fluid. So you're already in the area where you need to be, where the fluid is.
Right.
So you drain the fluid. You hold the needle. You don't let the needle move, and then you put your medication in, and you're in the right spot. No fluid, ultrasound's not recommended, in my opinion.
Right.
X-ray's better. It guarantees you're putting in the right place. And then, so the point is here, don't go running for knee surgery, total knee replacement, until somebody does it that does it the right way.
Right.
I don't care what they say. They've proven by doing blind tests where they take doctors who put injections in knees blindly to prove to them that they're going to miss sometimes.
Right.
And the general average physician misses 30% of the time when they do it blind. And how do they know this? When I put it in under x-ray, I put a little dye in it. I said, "Ooh, perfect," just like Janet. Perfect, it's in. Now I know it's in. So they tell the doctor, do your injection, but just before you put the medicine, put a little dye in it. And they do the x-ray, and they cover the screen, put the screen in a way that the doctor can't see it. They do like 100 of them, or whatever the statistics is. They might break it down, and they see how many they actually got it in. They got it 70% of the time. 30% they miss, which is actually pretty high. That's a good one. But some miss even more.
Right.
So that's the point here. It's a little orthopedic topic, but it's good. I mean, you need to talk about this because people need to know, because they don't know.
No, we have a phone number for those who want to call in and ask Dr. Jasper a question. It's right up on the screen right now. It's 732-237-4949. That's 732-237-4949. You can call right now. Dr. Jasper is here to answer your questions. There's no waiting room, no line, nothing. You got him right here. So give us a call.
Try to ask me a trick question. If I don't know the answer, I'll just make it up.
Right.
It'll sound good too.
It will sound good.
Yeah, talk about that. I had a very bad experience yesterday.
Yeah.
In my office with deals with Michelle. Yeah. Michelle tells me we got a new patient. We got a new system now where they used to give me a report in my office, see 3 patients, give me a report, and then we go back into the room. And on the way into each room, she would give me another brief little report, and we get in. We found out throughout the day we lose about an hour and a half, maybe 2 hours doing that. So now what we do is the nurses see the patient, and Nicole, they see the patient, and they come in and said, "I have a patient." So I get up, I go into the room right in front of the patient. She gives me a report.
Oh,
which is nice, because the patient will say, "Oh, if I got that," or they add more stuff to it, which is more. Excuse me. It's more efficient, and it's faster. So, but she, on the way to the room, she says, "I have a new patient that has pain in the lower back. It's shooting down the right leg, all the way to the calf." Right. I said, "Okay." So we go in. She gives me full report, which is basically that, a few other things.
right.
And he's never really seen any other pain doctors. But I go over the MRI, and I see exactly what's causing his pain. Now, we talked about earlier in the show, we talked about pain generators.
Yeah.
He's got low back pain. He's got pain shooting down his leg. He's got pain in the morning. He's got pain in the afternoon. But he feels good when he sits down. However, his low back pain feels good when he sits down. And this is, a lot of people listening might have the same problem. But he also has pain down the leg, which is worse when he sits down.
Right.
And usually sciatica type pain with pinched nerves, or pain caused from when you have a pinched nerve coming out of the spine. That's a sciatica type pain. And for some reason, anatomically, pressure goes more on that nerve when you sit down.
Right.
And that's part of the diagnosis. When it does that, it's a pinched nerve. And I can see exactly where the nerve is pinched in his spine. So I said, and I asked him, I had the MRI up on a like a 30-inch screen monitor. And I said, "Did anybody ever go over your MRI?" And he goes, "No." I said, "So you have no idea what this MRI shows?" He goes, "No." So I spent a good 10 minutes with him, just teaching him about the MRI, I want my patients to understand why they got pain. Because in my opinion, and patients tell me this, after I tell them how the pain is, how we can help them, they already feel better.
Right.
Because they know there's hope, because they see it. And any smart patient understands what's going on the way I explain it. So I explained it to him, and I said, "You know what? What's good about you is every pathology on this MRI that we're going over now, he understands, it's common sense of why you got that pain." And I told him, I said, "All right, this is how we're going to fix it." I said, "The first thing I want to do is I want to get rid of your leg pain, because there's very high probability I can get rid of the leg pain completely before we do any procedures.
Right.
He has spinal stenosis at 2 levels. So what he's eventually going to need, if the injections don't work for the spinal stenosis, he's going to need a spacer to open up the spinal stenosis.
Yeah.
I mean, I explained all of this to this guy more than 30 minutes I was in the room. Meantime, I got an office filled with patients. You know, you see 40 patients, and you spend 40 patients, you spend a half hour each of them, you're there for 2 days.
Yeah.
I don't know what the calculation is, but you figure it out.
Yeah.
So a lot of patients I don't have to spend that much time with, but he's new, and he seemed interested in learning everything about it. And when I tell patients what their problem is, like I told the guy, I said, listen, this is what I predict, but I can't guarantee anything, that I'll get rid of your pain down the leg, right? But you're still not going to be able to walk far. You can't stand up straight, and you're going to lean on the shopping cart, and you're not going to be able to stand up long, right? Because of your spinal stenosis. It's moderate to severe, right?
Right.
But don't be discouraged. And don't even be discouraged if I do the injection and the pain goes away in your leg for 2 or 3 days. I want to tell you everything we could do, because sometimes if you don't tell somebody everything that could be done, if it doesn't work, you give them an injection and they go somewhere else and say, it didn't work. I'm not going back there.
Gotcha,
and how do I know that? Not because of my patients. Well, if they did go somewhere else, I wouldn't know it anyway. But the way I know that is because patients come into my office and say, Dr. Jasper, the reason I'm here is because I got an injection by Dr. So-and-so, who I know is good.
Right.
Right. And they gave me the injection. It lasted for 2 weeks. It came back. So I'm not going back there. Didn't work. I was like, well, I know for a fact that doctor's a good doctor.
Right.
Didn't he tell you what he could do just in case it didn't work? He goes, no. So these patients don't know.
Yeah.
So if you don't tell them ahead of time and give them hope that if it doesn't work, like it didn't work at the other guy's office or the other doctor's office, there's other things we could do to make it work. So don't get discouraged. Come back and we'll go back to the drawing board and we go to the next step.
Right, right.
So I went through every scenario with this guy. You know what he said at the end?
What?
Doc, not for nothing, I just want to tell you that I'm only here just to see if you can make me feel good until I have my major spine surgery in October. I was like,
what?
How do you think I responded to that?
Not good. I know that.
I said, and I look at the clock. I said, where have you been for the last 35 minutes? Did you listen to anything I said for the last 35 minutes? And you still, with a clear head and a clear mind, say, I'm going for surgery October 1st or something. I was like, either this guy's stupid or he didn't listen to a word I said. I just blowing air out of my mouth. No sound came out.
Yeah.
I mean, I wasn't that sarcastic, but I'm being a little sarcastic now. But he goes, you know what he said to me?
What?
He goes, you know what, doctor? You're a good salesman. I said, I said, are you calling me a salesman?
That's like calling you a liar.
Yeah. I said, you calling me a salesman? Are you serious? I said, I just explained to you everything about what's going on with you. Do you think I made all this stuff up? He goes, no, doc, you're a good salesman. I got up, I shook his hand, and I said, good luck with surgery. We are done here. And I walked out.
Yeah.
And I walked out, and I noticed I went to go see another patient a couple minutes later, and he was still in there with Michelle. Michelle's like, he's asking Michelle the questions. So I asked Michelle later on, what did he say? He goes, damn, I must have insulted him. And she was like, are you kidding me? We are here for one reason, to pay our overhead. But the main reason is to make patients feel better.
Right, right.
That's what he does. And he has the compassion to do that. That's why he just spent over a half hour with you in here, which he hardly ever does.
Right, right.
Unless he has a patient that has your kind of back. A lot of times the patients are easier. I said, and you called him a salesman? What are you thinking? That's an insult. It's like, hey, you're a used car salesman. The only people who aren't insulted when you call them a used car salesman are used car salesmen. And they're proud of it. When you're a good salesman, you're a good salesman. I'm not there to sell what I do. I am there. Everybody's got to understand this. A good doctor is there to tell you what your pathology is, why you got it, and how you're going to get rid of it.
Right.
It's like going to a surgeon, like, going to me, it might not be exactly the same. It's like going to Dr. Schneider and you got a lump in your breast,
Right.
right? Which is maybe had a needle biopsy or something from somebody and it proved to be cancer. And she sits there for a half hour telling them all different scenarios how I'm going to treat it. And I got to do this and I got to do that. And at the end, and the patient says, "You're a good salesman." I mean, but the point is, if the guy would have said, "You know what, you're a good salesman, I'm going to do it because I like what you say." But he already told me he didn't want me to do anything to him, but just make him feel good until he gets the surgery.
Yeah, because he knows his other doctor wouldn't do that. He'd wait till the surgery and then get it done. So he's looking for a Band-Aid from somebody else.
I don't do Band-Aids.
Yeah.
And if I honestly can't fix it, and I honestly know that they need surgery, I'll send them to a surgeon.
Mm.
I got very good friends of mine that are surgeons, that would be happy to operate on them. And believe it or not, a lot of surgeons send me to patients knowing that they don't need surgery. And the surgeons that send me patients that they think don't need surgery, they don't expect you to give them an injection, fail, and go back to them. They know when they send them to me, they're doing it for the patient, that they know that they don't need it, and I'm going to get rid of their pain, and they're going to live happily ever after without it. They got plenty of patients they could operate on.
Right.
They don't need the ones that I know, they don't need to operate on patients that don't need the operation. They send them to me.
Yeah.
But that was, I can't believe somebody would say something like that.
Yeah.
With a clear head. Like, who the hell is he? So today, people just don't have respect for doctors, for teachers, for police officers, politicians. Well, all right, politicians, that's okay.
Yeah.
But I don't know. That was the point there. And then you got, not to be negative, but I got patients come to my office every day and say, I said, "Well, how'd you find out about me?" He goes, "Well, I looked at all your reviews, I Googled you, and you are the kind of doctor that I want to come to see."
Right.
But then we got a company now that sends us bad reviews and see what we could
notifies us when
notifies them
one.
when there's bad reviews. Not too many of them, but the bad reviews, people need to understand that you go to a restaurant and you don't like a server,
right?
They're going to give a bad review, or you just are jealous, or you don't like them. Well, who the hell knows? But people have such easy access to reviews; they could destroy a business.
So an irrational dislike for something or someone, that's an outlet for them to vent it.
Yeah.
And although it's irrational, it does, they don't understand even why they're pissed off about, to these people. Yeah, no, I've read a lot of reviews on Yelp and all of that, and these people just are hungry for that stuff.
We got a review not too long ago about a patient wrote the review. It says, "I went to the house. I went to Dr. Jasper's office, and and the nurse, she didn't have any compassion. She didn't care about the pain of my father or whatever it was. He was in a wheelchair, but he's able to walk a little bit. And she was trying to give a physical examination and made him get out of the chair and made him move his leg here and made him bend here. It just she tortured my father. She didn't care. She was ruthless." I mean, it's the kind of thing that they say. And then they said something else. You remember that one? Said something else like ridiculous, like they're in it for the money or something.
That's it. Yeah. He's in it for the money and not your pain. That's what it was said. That's
like, are you kidding me?
Yeah.
You got to take that stuff with a grain of salt. What are you going to do about it? I think we talked about one time a patient. I think we talked about it on the show. Remind me, but it's in the same topic. Just got people in here. We had a similar one. I can't remember the details about it, but this daughter reamed our office and our staff and me and everybody. Such bad things to say about it, and it was all because she didn't want to wait. She didn't want to wait for him. That was he had no respect. Like we have nothing to do. Meantime, the patient loved us.
Right.
And guess what? We got rid of all his pain.
Yeah.
Right. And she put her name down, and I said, who's the patient? I called the patient up, and I said, how you doing, Mr. So-and-so? She goes, Doc, fantastic. He goes, you're the best pain doctor in the world. I've been to all these pain doctors. I never got any relief. You finally gave me relief. I got my life back. I've been, you know, the guy praised me to the end.
Right.
And I said, do you ever go through Google review? He goes, what's that?
I remember this one. Yeah.
He goes, what's that? I said, well, did your daughter tell you what she wrote on Google review? He goes, what do you mean? And I said, I'm going to read this to you. And I read it to him. He goes, oh my God, why would she do something like that? That would deter people from coming to see you. And I am so happy with you.
Right.
And I said, he goes, Dr. Jasper, I apologize. I said, I will, what would you like me to do? I said, well, talk to her about getting that off of there, because I can't take it off.
No.
The only person who can take it off is the person who put it on.
Really? Yeah.
And he goes, within 20 minutes, I'm going to have that off of there. Believe me.
Mm.
And 20 minutes later, it was gone.
Yeah.
You know, but the patient at this last one that just left, about the head nurse,
Yeah.
that was ruthless, didn't leave the name.
Right.
And I guarantee you that the father or the mother, whoever was in a wheelchair, doesn't even know that they put that on there.
Yeah.
You know, so I don't know who it is.
Sometimes you get these the kids of the parents, and they have to drive them around. They get you know, feel like they're getting inconvenienced, and then they want to lash out at somebody. It's like a little kid trying to lash out, you know. It's really sad. Very sad. We got Felix. He wants you to tell the squirrel story.
The squirrel story.
Yeah. Let me put it up on the screen here. There you go.
Is he talking about the squirrel story with my father?
I don't know. Felix, give a shout out. What squirrel story?
Well,
so you have more than one squirrel story
There's
then?
a few squirrel stories. Well, you know, we were talking about this morning because, you know, we have a garden.
Right.
I got a nice tomato garden. The tomatoes now are beautiful.
Really?
People next door with they're Sicilian, got the Sicilian eggplant.
Ooh.
And they're gigantic. What's good about them, they're kind of purple and whitish. That might be Felix.
Mm.
They're kind of purple and whitish,
yeah,
and big. And you slice them, and there's hardly any seeds in them. And you put a little olive oil, you know, garlic, salt, and pepper, and you put them on the grill. They're delicious.
Yeah, he says that's the one.
Yeah. So what happened is Felix was telling me about, you know, he lives in a city, and there's a lot of woods, and you know, there's a lot of squirrels. I live on the water. Every once in a while, you see a squirrel. Plus, I got my dog.
Zuki,
cruising around, and he doesn't allow any squirrels in the garden. He's got specific orders: no squirrels in the garden.
Right.
Sometimes he lets a rabbit slip through or something. I don't know. Maybe he's got some deal with him. I don't know. But anyway, you're talking. I was in medical school in Italy, so you're talking in the 80s.
Okay.
And my father called me up and told me a story. What happened? Like Felix, he said he caught like 15 squirrels and 15 squirrels, and what else was it? Was it a woodchuck? Whatever it was. And I said, well, where do you bring them? To Rutherford? And then we started laughing. And that's how we were. Because Passaic is a town up north, and you got the Passaic River, and across the Passaic River is Rutherford.
Okay.
Right? I said, Phil, where'd you put him? He goes, I got a place I put him. I'm not going to tell you where I put him. Right?
The other one was a possum.
Oh, possum. That's right. So my father tells me a story, and every Saturday, you know, he had time. He wasn't working. He would do his garden. He'd pull the weeds out, and he'd have, like, you know, 4 or 5 traps filled with squirrels, because they would eat all the tomatoes. They'd eat all the vegetables, and they'd eat the peaches, the everything that he had. So he would bring them across the river to Rutherford. You remember the story?
No, I've never heard this one.
And he would always say, he goes, this is like an endless reservoir of squirrels. He goes, I bring 10 of them over, and the next week I bring another 10 over. I must brought thousands of squirrels to Rutherford.
So he's catching them live?
He's catching them live in the what do you call that trap? That one that doesn't hurt them?
Yeah.
Right? Save us something, whatever it is. and he would put him in the back of his car, his Suburban,
Right.
and he'd drive him to Rutherford Park. And then he goes over the bridge, he pulls into the gas station and get gas. And my father was always the kind of guy that gets out of the car,
Right.
and like make sure that they put the gas in, they put the gas cap on and everything,
Yeah.
talk to the guy.
Old school gent.
Yeah.
Yeah.
And he's walking around, he sees a guy at the gas station going toward Passaic. And he looks in the back of his truck, and he sees the traps filled with squirrels. And he goes to the guy, he goes, "Where are you going with those?" He goes, "I'm going to Passaic Park." He said, "You're taking these squirrels to Passaic?" He goes, "How long you been doing this?" "For about 5 years." He goes, "Me too." He goes, "Come here, look at this." And he looks in the back, he goes, "Where are you putting those squirrels?" He said, "Rutherford Park." He goes, "Where do you live?" My father said, "I live right next to Passaic Park." "And where do you live?" "I live right next to Rutherford Park." So you got to imagine these squirrels, right? For 5 years going back and forth. Probably the same squirrels, the same 10 squirrels. And they're sitting there, they're like, Dr. Jasper put out the crab trap.
Oh, okay.
Put out the squirrel trap. Do you feel like going to see our girlfriends over there in Rutherford for the weekend? Yeah, what the hell? And they're saying it, and then they go over to Rutherford for a week.
Yeah.
And they're saying, "Hey, Mr. So-and-so's got his traps out. You want to go back to Passaic, see what the family's doing?" Boom, back into the thing.
Every squirrel's got 2 nests.
Yeah,
They go, "We're going to go to the summer home this week."
They're definitely not monogamous, I'll tell you that. They must be polygamy going on over there. Can you imagine that? That was one of the funniest stories.
Oh, my cheeks are killing me. That was fantastic.
You never heard that story.
Oh, no, that's got to go on the best of reel. That's
you know who
hysterical.
Felix is? You know who Felix is?
Yeah.
Felix is a guy, we were in Italy,
Yeah.
and we bought that cadaver head,
That's right.
and we forgot it on the bus.
That's right. That's
Yeah.
right. Felix has been part of all the really gem stories.
Yeah.
Yeah. Can't even believe that.
Yeah.
I get the odds of them meeting up.
Well, they ain't great odds because it took him 5 years to figure
Yeah,
it out.
that's true. That's true.
And how many times did he get gas at that place?
Oh my god.
So you're right. The odds aren't that good.
Yeah. Yeah.
Anyway,
Oh god, that was fantastic.
that, a little bit of fun in the stories because a lot of my patients love these stories, and they talk about, "Hey, doc, I heard the story." The other story about, remember when I was in college, somebody stole my convertible Alfa Romeo.
That's
And I
right.
come running off the top of the cliff and dove into it and into the back cockpit of the car and knocked a couple of them out. That was when I was young and athletic.
Right.
Now I'm old and athletic.
Oh god. Oh my freaking cheeks.
But anyway,
we got Marie Elena. Sorry if I messed that up, Marie. She says you're a great doctor.
well, thank you, Maria.
Yeah, and your lovely sister, Maria. She
Maria,
says
you're back from walking?
she says great story. I never knew. It's have a heart trap.
Have a heart trap. Yeah.
Yeah.
Have a heart trap. Yeah. We don't believe in catching them with those traps and they chop the legs off and they
Right.
you wait 3 days to go find them suffering like that.
Right.
We have a little bit more compassion than that.
Yeah.
Anyway, a little about what I do. You want to talk about what I do?
Yeah. Let's talk about what you do.
All right. I get rid of pain.
Right.
And there's different ways of doing it. But the biggest thing these days, which is probably, I'd say it's probably more than 50% of my practice, is get rid of spinal stenosis. And spinal stenosis is a disease that is a progressive disease. And I don't know if they proved it, but in my 27 years of practice, I say it's genetic because I've had parents and their offsprings in my office complaining about the same thing.
Mhm.
And it's the central canal stenosis where in the center of the canal right here, it closes down on all the nerves, all these nerves coming down through the spine, and it puts pressure on it. And the pressure is worse when you stand up, right? Because this collapses. When you sit down, it opens up. When you lean on a shopping cart, it opens up,
Right.
right? When you lean on a counter, it opens up. Some people are so bad they walk down the street and they have nothing to lean on. They just bend over or squat, and it opens up and relieves the pressure off the nerves, and they get back up and they can walk about the same distance. How do you get rid of this pain without major surgery? We do a 5-10 minute procedure, and if it's a tough case, 15 minutes. Put a spacer in here, right here. It locks in, right, and it prevents it from collapsing. It keeps it open, so it keeps the ligament flat. I mean, I can get into details about that. That the ligament folds when you stand up, and it flattens out when you sit down, so it feels better. The point here is a spacer makes it feel good. But sometimes that ligament is so thick, I got to go in there and do another procedure and take some of the ligament out. So there's a little prerequisite.
Yeah.
And this is part of the reason why I tell my patients there is no such a thing as fixing your back once and for all. And this is a very common topic we talk here, and I'll beat it to death. You go to a good interventional pain doctor or even a good surgeon, don't expect them to fix it all in one shot.
Yeah.
If a doctor tells you, I'm going to have to fuse you from L1 down to S1, you run for the hills.
Oh, yeah.
That ain't going to help you.
Yeah.
You could have every one of those levels pathological, but I guarantee you, out of the 4 or 5 levels, maybe only 1 or 2 have really given you some problems. So why do them all?
Right.
That opens up a can of worms. See, surgeons don't want to go in there multiple times because it's a big surgery. So they want to fix ones that look like it might be bad. Not all of them. Not all of them. I've seen plenty of patients with 1-level hemilaminectomy that have done great for 10 years. Right. But I've seen patients that come to my office with every level with a laminectomy and every level fused. Well, I'm a little prejudiced about it because if they were good, they wouldn't come to my office.
Right.
But everyone that comes to my office, it's almost like I can't even do anything for them.
Yeah.
They didn't leave anything left. They got scar tissue, right? They got all their back muscles are completely atrophic because they had to open up the back. When they put it back, most of those muscles die.
Oh.
You look at the MRI, it's all white. There's no like that deep color of protein, strong muscle anymore.
Right.
And that in itself is painful.
Wow.
So, I mean, you got to understand that, like I said, I'm going to beat it to death. I'll beat it like a dead horse.
Like a dead horse.
Anyway.
Yeah, but you're not wrong.
One at a time.
Yeah.
I've done patients with every level bad. I do one hole. I open up one hole where the nerve comes out, 1 out of 10 holes, because you got 5 levels, 1 on each side, right?
Right.
1 hole, and everything looks bad, but I inject and I numb that nerve, and they're 100% pain-free.
Yeah.
And I know that's the main problem. I go in, I open it up, and the pain is gone, as if they don't have a bad back anymore. And you look at their back and say, how the hell they walk? So it happens. So you need to do 1 level at a time.
Yeah.
And that's it. In fact, most of the time, the insurance companies will only pay for 1 level. And, they do that for 2 reasons. Number 1, they want to pay the least amount possible. Number 2, I think there's a little method to their madness. I hate to say it, and the reason I know this is because I used to do 2 levels at a time.
Yeah.
Where the insurance companies would only pay for 1 level because I felt in my heart that this patient needed 2 levels. And I talked the company into giving me the spacer for the 2nd level for free. I said, I'm doing the procedure for free. The patient needs 2 levels. You give me that for free. And they gave it to me for free because I was doing so many of them, they were still making money, right? And then they sold to a corporation that said, that's it, no more. We don't give anything away anymore.
Yeah.
So I was forced to do 1 level at a time because if I had to pay for a 2nd spacer, prosthesis there, that would eat up any kind of profits. And I would have to take money out of my own pocket to pay for the extra one.
Right.
So not only eat up the profits, I'd have to take a few $1,000s out of my pocket. I mean, I love my patients, but I don't love them that much. I'm not working and paying for their procedures. So I stopped. And little did I know that a lot of those patients, probably 60% of them, I did 1 level and they were good. They didn't need the 2nd level.
Right.
So I can't believe that the insurance company only pays for 1 level with the premeditated thought that chances are they only need 1 level. No, they only do that because They don't want to spend the money.
They don't want to spend the money.
But it just so happens that it's not a bad thing to do one level, certain procedures, not a bad thing to do one level at a time, because it's a good chance that the patient, not a high percentage, but there's a chance, not a high, that the patient might not need the second level. So if you don't need to do a second level and you do a second level, there's always a chance for a complication where it was unnecessary to do.
Right.
So there's some rationale behind that, and I explain that to my patients. But like I said, spinal stenosis, you can't walk far. You got to sit down. You can't walk upstairs unless you pull yourself up the stairs. You got to lean on the shopping cart. I had a patient yesterday. Michelle laughs every time. Actually, it was this patient that called me a salesman.
Oh, really?
I asked him, I said, I bet you don't have any stairs in your house. That's my first question. And probably 80% of them said, I used to have stairs in my house, but we bought a ranch and we don't have any stairs anymore. And I don't have to worry about them because I can't climb up the stairs without pulling myself up the banister. And the guy, before I even asked him, when he said, yes, I have stairs, I was going to ask him, how many you have? He goes, yes, I have stairs. I got 12 stairs on the first floor. I got 7 stairs on the second floor.
Yeah.
And then as I walk into my house, I have 3 stairs. And then go up into the attic, I have 14 stairs or something.
Yeah, yeah.
He knew exactly, like 4 or 5 flights of stairs that he had. He knew exactly how many. People who have spinal stenosis are the only ones that know how many stairs because they count them.
Yeah.
They're like, I only have 3 more left. I only have 2 more left. 1 more left, and they get up there.
It's like climbing a mountain.
Yeah, because they just can't do it.
Yeah.
And this guy burned his bridges, and could have been treated with a simple 5-10 minute procedure.
Yeah.
But he burned his bridges. I mean, listen, am I the kind of guy when a guy comes back and said, Doc, listen, I apologize. I didn't mean to insult you. Can I still come to see you? I'm not going to say no.
No.
Because, I'm the kind of guy that doesn't hold grudges. I forget about it.
Right.
And quite frankly, the guy probably didn't want to insult me directly. He just, I don't know what he was thinking. Some of those people just,
they don't think before they speak.
They blurt out stuff without even thinking the consequences of it. So you got to forgive a guy like that. You got to slap him in the lip or something.
For those of you tuning in, dial back a little bit because you missed an amazing story about squirrels, and you will absolutely die laughing. I did.
Where's the list of people in room?
We got them up here. See, little eyeball.
Yeah.
Tells you who's listening.
Right, what else is good that we could talk about? The weight is getting better. In my office, we're trying to figure out how we can make the weight better.
Yeah, you were saying that near the top of the show that you're doing the reports in the exam room, and that's just you're constantly.
We're doing now. We're getting done at like 3:30 instead of 5 because of that. So that's a significant. Which means that some of the patients don't have to wait as long to come to see me. We could probably put some more patients on so they don't have to wait an extra week or whatever.
Yeah.
But by the way, I mean, you call my office, which is, you didn't tell them the number of my office. But
I have had it up on the screen, though. Yeah.
Oh, you did?
Yeah.
Yeah. So you give my office a call at 732-262-0700. And if you're in a lot of pain, we'll take you in either that day or the first available day that we see patients. And I'm not saying first available day that there's an opening. If you call on a Monday afternoon late, chances are you're not getting in that day.
Right.
Everybody's starting to leave and everything. And we can't get you in on Tuesday, but we'll get you on Wednesday because Tuesday we have operating room days. But if you're really, really severe, we might get you in on a Tuesday. Because we don't want you to, especially these patients that fall and break their back, and they got a compression fracture. I had a patient come to my office that actually saw it on the. I guess we must have one on cable TV or something, an advertisement about kyphoplasty and compression fractures.
Yeah, we do.
Well, I had a patient come in at the beginning of the week on Monday, I think it was, that said. She fell on the edge of a pool into the steps, right? Broke her back. It was 2 levels she broke. broke the vertebral body in the back, this bone here, broke this bone. And that's probably one of the most painful, and we talked about it all the time, the most painful pain that you could have in your back. You can't breathe, you can't move, I mean, she looked like she was walking on ice, or eggshells.
Eggshells, yeah.
But didn't want to slip, like ice.
Mm-hmm.
And she said that she went to the emergency room and they gave her, it's my sister Jones, she know I got this, anyway, they gave her pain medication and told her to call her primary physician. And that was it, sent her home. And then she called an orthopedic group, went to the orthopedic group, and they made her inhale something and gave her some muscle relaxant painkillers and said, rest. And I'm like, so how'd you find out about me? He goes, well, I was sitting around in severe pain, and I happened to see your advertisement on TV, and that you fix these things. I said, yeah. And we fixed her, I think, the next day, and she was pain-free.
Right.
It's people say you're a salesperson, you advertise, you need to advertise, all this stuff. I mean, look how nice that was that lady was in pain for 2 months. 2 months she was in pain. She calls my office in 2 days, she's pain-free.
Yeah.
I mean, a lot of it has to do with most of it has to do with the patients. To let you go to a doctor's office and say, we're not going to do anything for you. Just take pain medications and rest. When there's something that you could do to get rid of the pain instantly. Yeah. It's called a kyphoplasty. We put in this, they call it cement. We put in the cement. Well, I call it medical epoxy because that's what it is. You got to mix it like epoxy.
Two things that go into one and they mix.
And you put it in, you could see it fill up the cracks.
Yeah. And
I make sure it fills the cracks up. When it fills up the cracks, it gets hard as, not rock, it gets hard as bone, which is like hard as rock. Right? And it doesn't crunch anymore.
Like fast, too.
The pain is gone.
Yeah, yeah.
Well, I've had patients that have had it for 6 months and they just can't heal up. And they eventually see my advertisement, or they go to, there's surgeons in town that don't do it. And they go to their office and they send them to me. Because I'm one of the few doctors, might be 1 or 2 doctors in Ocean County and Monmouth County that do it, and I'm one of them. So of course they're not going to do it if they don't know how to do it. They tell you to go home and rest. You would think they would send them to me. I don't know why they don't, but the certain surgeons do.
Yeah,
and I fix them, and they do great. Now you got to realize that if you can't breathe deeply, you can't sneeze, you can't cough because there's so much pain. You can't move around. I mean, that opens up a whole can of worms, a whole new can of worms where you can get pneumonia from not breathing deeply. You can get blood clots in your legs because you can't move around, right? There's just so much stuff that you can get because of that,
right?
Because you're in so much pain. So you get rid of pain, the patient's a good thing.
Yeah,
that's why we do it. So that's kyphoplasty.
We got this Wednesday. We are filming 4 new TV commercials.
This Wednesday?
This Wednesday, yeah.
Do we have any idea what we're going to talk about?
Yeah, I got rough outlines because that's the best I can do for you because you like to do it right on the spot.
Yeah, but what topics?
Oh yeah. I have a list of. I want to do. I want you to talk about endoscopic ones. I want you to talk about the spinal stenosis. They're going to be fun commercials too because you're going to. Well, I won't ruin the surprise. I want people to discover it on TV. But we got 3 commercials with you, okay, and we have 1 commercial with Dr. Scoblar, yeah, and we got that. So I hope everybody looks forward to seeing that on their TV. Something fresh.
What channels are they going to be on?
They're going to be on all cable. I mean, so many cable channels. It's ridiculous. Like for those of you who like Hallmark Channel, we're going to be on there. FX, MTV. I know a lot of moms like watching their shows on MTV. Yeah. We're going to be everywhere. Everywhere. That's why everybody knows you, or they know your voice.
It's funny that I got a friend of mine that we were raised with Passaic, and he
Yeah.
lives down here. Like 3 days in a row at like 6 o'clock in the morning, 6:15 in the morning, I get a text message. Another good commercial. I'm looking at it right now. Come on. Don't text me at 6 o'clock in the morning.
They get excited.
6 o'clock in the morning. And Rosa's
Nobody
like,
should be excited at
Rosa's
6
like,
o'clock.
who the hell's texting you at 6 o'clock in the morning every day now? Gets me in trouble.
Yeah.
Text at 6 o'clock in the morning. It's like he's probably been up since 4 o'clock and thinks everybody else is up since 4 o'clock in the morning. I usually get up at 6 o'clock in the morning, including today.
Oh,
That's the time I get up. I just can't sleep past that. But sometimes it's a little bit before 6 o'clock when I get a text message from him.
right.
Funny.
Now Maggie wakes me up and I'm like, 5 more minutes. I'm like, I'm in high school again,
Yeah.
5 more, no.
I just pop up. I mean, I get up. This morning I probably could have slept a little bit later.
Yeah.
But today we're going out. Like I said, we're going to go out in a boat. We're going to have a good time. Let's hope the weather holds out.
Yeah,
It's
let's
a little bit
hope.
overcast, but according to the Weather Channel,
It's not going to rain.
it's not going to rain. It's all going to be up north.
Oh,
But
okay.
you could see it a little bit down here.
Yeah.
So maybe you get an isolated
Spritz.
shower, but that's
Yeah.
about it. But that's good. So
Yeah.
let's we're doing good. We're doing good in the OR. We're working. We're taking care of patients, and like I alluded to, the fact this new system, patients are not waiting as long. So we probably get less complaints.
Right.
But it allows for more urgent patients coming in. There's no such a thing as an emergency when it comes to us.
That's what I wanted to say real quick. When I walk past or walk through the exam room, sometimes I'll hear the patients talking to the front desk or talking amongst themselves. And I sometimes hear, why did they book so many people when it gets all crowded in the waiting room? It's because of what you just said. We want to get everybody in who's really suffering and get them taken care of. And some of the people that might be saying those things are the very same people we got in to make sure they don't suffer longer than they need to. So that's really the reason.
And most of the people that complain about it are people who are new patients that don't know us.
Yeah, don't understand how things are done or go.
And they come into the room. I spent time with them. They say, "Oh, now I know why."
Sure.
Why it takes so long.
Yeah.
And you can't. Not everybody's different. You can be quick. You can be long.
Right.
And the OR, the same thing. We can have a lot of cases that day. We schedule them properly, but we have one case that happens to take a longer time than you expected.
Right.
So that's it.
Yeah, that was a great show. The squirrel thing is going to kill me for the rest of the week. I'm going to tell Maggie as soon as I see her about it. That is hysterical.
Yeah. I've heard that story from some other people too.
Yeah. Oh, yeah. Yeah.
All right. Well, thank you very much for listening. We hope to see you guys in the office to get rid of your pain.
Yeah.
And that's what we do. That's what we do. You break it, I fix it.
That's great.
All right.
All right. For more information about Dr. Gabriele Jasper and all the things we talk about on our show, please go to jaspermd.com and you can make an appointment with him by calling 732-262-06.